Because I'm a cardiologist, I sometimes see people who are breathless not because of COVID, but because of heart failure. And it became apparent that that team who were going out to assess older, more vulnerable people with potential symptoms of COVID actually were finding patients at home sitting with heart failure, too fearful to access the normal channels. That could have been a disaster, but in fact we learned a lot from that, and some patients' experiences were really enhanced in that they got a quick assessment in their own home. They were able to have treatment in their own home. The physician who was looking after them in their home was able to contact me for advice, and we set up a Teams group where we could do very quick, rapid turnaround, what you might call case discussions or MDTs. And I could give advice on treatment, and where it became clear that that patient was more precarious at home, perhaps might require to come into hospital, again, we were trying to avoid that. We quickly set up an ability where we could give them some of the treatments that they required in hospital, for example, intravenous diuretics, but on an outpatient basis. So they came up, had the diuretic, and went back to stay in their own home. So I know lots of the descriptions of care in this time are descriptions of care that's been less good, but that for me was an example of care that paradoxically was better, more person-centered, and was able to be delivered in a way either in the patient's home or in an ambulatory way where they could come in and out of their home. So that was a positive experience to start with. I think on the other hand, in general, we noticed fewer patients coming to hospital with complaints, for example, of chest pain, and we wondered where those patients have gone. And then more specifically, we recognised that there was, I would say, across the piece, quite a loss for patients in a number of areas. So many people felt that they lost the face-to-face contact that they would have had with a caregiver, particularly a nurse practitioner or a doctor. I recognised when I was telephoning people that that might have been the only contact that they'd had with anyone that week. And they were keen to stay on the phone and chat and really to ask questions, not so much about their healthcare, which was really diminished, but a lot of questions about the current state of affairs and about coronavirus and how to stay safe. So that kind of encompasses the range of experience to some extent. Other patients we know who were expecting treatments, things like bypass surgery or valve replacement surgery, they certainly had a hiatus in their treatment. But I would have to say that both the major centres that we deal with worked really hard to make sure that we quickly triage people around clinical need, and those people who needed to go ahead and have their cardiac surgery still had it.